Hello and welcome back to What's on Your Mind podcast. And today we have a wonderful guest with us, Kelly. She is a registered psychotherapist, and she's here to talk a little bit about her journey as a therapist and some more about her specialties. So we are super excited to hear all about it. So yeah, if you want to just kind of start with, how did you kind of know you wanted to be a therapist? How did you get to that?
Sure. All right. Well, thank you for having me. Um, yeah, so like going way back to high school, I never felt like I had a great skill or talent or excelled in anything. I was just kind of average. But my friends, there was sort of this recurring theme. My friends would be like, "You're the best listener."
Aw.
And yeah, so I mean, at times I'm like, sometimes that feels like an insult. Like that's all I can do is listen. But I know it wasn't. So I just kind of had in my mind, like, well, what's something I can do that involves listening? And naturally, therapy came to mind or being a counselor. And then I went through some kind of big tragedies in high school. Um, and so I saw a little bit of grief counseling, not a ton. Looking back, I wish I would have done more, but
Mm.
um, at that point, I thought, well, I'd really love to help people who go through some of these things, death and loss and things like that. Um, so that was high school. So kind of planted the idea. And then, sorry, I have something in my throat.
It's okay.
Oh, yeah,
Um,
JTM.
and then going to college, though, I didn't pursue anything in undergrad, specifically psychology or counseling or social work related. I did my undergrad at Moody Bible Institute and did just like a biblical studies major there. And I did this knowing that I would already be, or I would plan to pursue my master's in counseling. So the plan was still there, but I had always sort of wanted to, there were some things that led me down this path, and going to school in Chicago sounded really fun.
Yeah.
So I did that. And then shortly after that, there was marriage and moving to Canada and then moving back to Michigan. And in Michigan, I pursued my master's of counseling at Spring Arbor University. So I did that. That was a couple of years. I think it was 2013 to 2016. And I did my internship there at the college in the counseling center. So I really gained a love then for college students.
Mm.
I really liked just they're goal oriented for the
True.
most
Yeah.
part, so many of them had issues, like they're freshly independent,
Yeah.
somewhat independent, and it was amazing to me how many came in wanting to work on family issues, like their broken families back home, or not
Yeah.
even necessarily a broken family, but just things from childhood. And I
Sure.
thought,
Interesting.
yeah,
Yeah.
it's like now that they're removed from their home environment, there's all this stuff coming up for them, and maybe they're realizing it as coming out in relationships at college or something like that. Was kind of just a recurring theme that I noticed. So at that point, I felt this pull for college students, and then also families, maybe family therapy. I wasn't really sure, but something like family related or
Mhm.
family based. So from there, and it was during this time too that I volunteered at the Aware Shelter in Jackson, which is where I met Cassie.
Yeah.
So we volunteered there together. We did the training and just clicked. And I think we volunteered in different spaces. I
Yeah.
was at the Child Advocacy Center in Jackson, Michigan. And so I helped out just making families comfortable as their children were interviewed about really awful things that
Oh,
they experienced.
Yeah.
So yeah, that was eye-opening, and also just kind of opened up this other, like I got to see more of families. Right now, here's families that are dealing with the courts and a forensic interviewer and trauma. And so that was just kind of another piece in the puzzle, I think, that sort of led me to where I am now. But so I volunteered through there. And then once I actually graduated and was licensed, I worked for a family reunification program at Orchards Children's Services in Ann Arbor, Michigan. And so I did that, and I was going into homes of families who were just receiving their children back from foster care. So I would
Wow.
help with that bonding
Yeah.
process.
Oh my goodness. I can only
Yeah,
imagine like some of the
Yeah.
experiences you must have had, like positive and negative, right? Like just tons of
yeah,
emotions.
yeah. And I
Yeah.
learned a lot about, the standards of, well, like what families have to go through to get their kids back. And then
Sure.
also, just the difficulties with the system, right? Of like, is it really right for this child to go back? But also the trauma of being separated from your family, as
Yeah.
difficult as things might be at home. Um, so I went through, a lot of sort of existential processing during that time.
Sure.
And I think there's still a lot of areas there that I can't come to a good conclusion. Because these are kids you're dealing with. And
Yeah.
So complicated,
yeah,
Yeah.
complex, not simple at all.
yeah.
Yeah.
Even things like as small as, you can't take a kid away or keep a kid away from their family for living in a dirty home. But at the same time, sometimes I would leave homes and think, how can a child live in this, And
Yeah.
so
Exactly.
even things like that, even apart from any
Mhm.
physical abuse or anything like that, right?
Yeah.
Like it just there were things to work through. And
Mhm.
so another piece in the puzzle, I guess.
Right.
So I did that for a little bit, I think not even a full year. So actually this is part of the story of how I wound up in the niche I'm in now. During that time, I was married, and we had decided to try to have kids. I was working that job in 2016. So we'd been trying for 3 years at this point.
Okay.
So it was really, I found it was so difficult emotionally to
Mhm.
work with these families who had their kids taken away when I wanted a kid so badly. Um, and just, the way that they would talk to their kids. And
Mm.
not that I am at all the perfect mother. I am definitely not. I certainly, yeah,
But
I'm
it's
not the best.
hard.
Yes,
It's
yeah, but
hard.
it was difficult to go into these homes. And at one point during that, I actually had a miscarriage. So we did get pregnant, and then I had a
Oh
miscarriage.
dear.
Oof.
And it was actually after that, I think a couple months after that, I decided that I couldn't do it, at least for the time being. Um, so I found another job, which I don't know if it was really that different of a move looking back, but it was with the Student Advocacy Center of Michigan, which is based in Ypsilanti, but serviced the Jackson and surrounding areas and some other areas in Michigan. And they're basically a truancy prevention program, but the aspect that I worked with was going into the homes and working with families on sort of like case conceptualization, like what's the barriers to your children attending school,
Yeah.
um, and what can we do to fix that, or
Mm.
remedy that. And so that was a little lighter. Like there wasn't abuse and neglect going on, right? I wasn't seeing how, just, yeah, it was lighter. It was not quite as hard. But I was still dealing with that infertility, and it it still didn't feel like the the right fit for me for that stage of my life. So I was always sort of just looking around, but it was a good job. It was really flexible. I did like the working with like the schools and the families. That was just kind of a dynamic that I enjoyed.
Yeah.
Um, so from there, then I had applied, I think straight out of grad school and getting licensed. I had applied where I work now at a healing place in Jackson, Michigan. And at that point, they were not taking any more limited licensed practitioners.
So what does that mean? Limited license?
Yeah. So in Michigan, it's you first, at least for counselors, it might be a little bit different for social workers, but for licensed professional counselors, first when they graduate and get licensed, you have a limited license, I think for 3,000 hours of practice.
Yeah.
Is that right, Cassie? Okay.
Yeah, it's 3,000. Yeah.
Yeah. And like 1,000 of some amount of supervision hours.
Right. And
Yeah,
it's
it's
equivalent
baked
to
in.
something that goes on here in Ontario too,
Yes.
with
Yeah,
like,
it's very
qualifying
similar.
status, then
Yeah.
turn
Yeah.
into a fully
Mhm.
qualified practitioner. Yeah.
Yes.
Yep.
Yeah.
Yeah,
Because I
exactly.
did get I am a registered psychotherapist or RP here. And yeah, when I moved here, and Cassie, I know you had to do that too, went through that whole
Oh, yeah.
process. And,
Not fun.
yeah,
No?
and I think Ontario must require more hours of supervision because I had my full license in Michigan, but I was qualifying here.
Okay.
So I think
Okay.
Ontario might have a few more requirements.
I think
Anyways,
you're right.
yeah. So anyways, yeah. So they didn't have a position for me, but then I think it was December 2017. There's 3 co-owners, and one of the owners reached out to me and said that there was a position. And so I applied for that. And at the time I actually had gotten pregnant. So I was pregnant. So that was exciting. And so I started there that December, and then I went on a short maternity leave after I had my son in April 2018. And so at that point, I could only, since I was still limited license in Michigan, that means most insurances
Yeah.
Wouldn't cover your services.
yeah. So I was just
Yeah.
seeing Medicaid, and basically just Medicaid.
Yeah.
So, which is fine. I'm fine with seeing them, and I see Medicaid population now. However, that does mean I couldn't just like pick a niche, right, and say I just want clients in this
Yeah.
area. And even at that time, I was brand new, right? I was green, so I didn't fully know where I would end up. So yeah, worked there in person for a bit, almost a year, and then came the move to Ontario. So now I'm close to Windsor, Ontario, and that was then when I started my the transfer of, I'm still licensed in Michigan, but I'm also licensed here as a registered psychotherapist. So that took like a year or maybe a little more. And so then I started doing some services through the Crisis Pregnancy Center in Windsor, and still working for a healing place. I was doing telehealth. So I was really thankful for that, to be able to do that. And of course, then during COVID, like that just ramped up, and
Yeah.
Yeah.
many more clients during that time. Not that I'm necessarily grateful that all that happened, but as
Sure.
we all know, it really changed things for the workplace.
Yeah.
So yeah, I've continued to be, the majority of my time is through a healing place, but during that time, so it would have been like 2020, 2021, maybe, I pursued the perinatal mental health certification through Postpartum Support International.
Wow.
And so that was, I think, 8 live webinars, and then like, not like homework, but kind of like homework, and just all their requirements. There was an exam involved. And that exam fell on the morning of, Cassie, you might have experienced this too, and maybe Tori and Kitchener as well. There was, what year was that? 22 or 23. There was a big ice storm like overnight.
Oh, yeah.
And all the trees were falling.
Yeah.
Yeah. And,
Yeah.
and our power went out.
Yep.
And so my exam was the next morning, and I didn't get to study for it. I was studying up, like before that, but I didn't get to study the night before.
Oh, no.
The power was out and the kids were, freaking out. And, and then I did not sleep because all night I just heard all these massive branches falling down.
Oh no.
So
Oh my goodness.
yeah, it was like maybe close to worst case scenario for like the night before an exam.
Yeah.
But
Good
but
grief.
I passed it. I went in and it was
Yeah.
at like 8 a.m. and it kind of looked like the apocalypse happened
Yeah.
driving into Windsor. But anyways, I passed. So now I am perinatal mental health certified. And so oh, go ahead.
No, I was just gonna ask with you, and you might be about to answer it, but with that training, did like what did you learn? Like what was the most valuable thing you
Yeah.
learned from that experience?
Well, within that training, it covered the perinatal experience, like perinatal mental health, postpartum mental health, and post-abortion support and infertility related mental health.
Wow.
Excellent.
Yeah.
Yeah. So it wasn't like just postpartum or just perinatal. It was just this whole wide array
Right.
of things. So I don't know if I could pick one thing that was most valuable. But I just learned like, there's every population has, just special different language to use with them and different complicating issues. Like I learned a lot about hormones, the difference in hormones, like after, while you're pregnant, after you have a baby. And at this time I had 2 kids and I think I was pregnant at that time, and then had our youngest in the midst of that training maybe. So like
Okay.
I had experience.
Sure. You were living it as you were learning it.
Yeah. But it was different to learn about these things professionally.
Sure.
And so, and then the infertility part was really special. So the way I ended up having my children was through, it's similar to IVF. It's called embryo adoption. And it's when like couples who do IVF, but then have embryos left over and donate them back to a clinic. We adopt those embryos and just transfer, so not full IVF. And so we were doing that. So I have this, kind of relatable experience to
Sure.
clients that are infertile as well. So if I were going to pick one thing that was most valuable, I honestly think it would be the webinar that was on psychopharmacology and the perinatal and postpartum period, because there's just a lot of assumptions and misunderstandings about being on medication while pregnant, or while nursing.
Mm-hmm.
Sure.
And I mean, so much of the time it's like the risk for someone who deals with depression or anxiety or mood, like bipolar, whatever they may be dealing with, the risk of going off the medication is often worse than the risk to the baby. And the majority of medications that we went through have little to no risk to
Interesting.
the baby.
Yeah, interesting. Yeah, because that's like the opposite I always learned.
That a
that
lot
it
of
was
people
like,
here think of,
yeah.
right?
Yeah, and I'm sure there would be, people that would argue that.
Sure.
Like you can always find a study, right?
Fair enough. Yeah.
Yeah. So, but it really was, I mean, these were, this was there. I read a lot of studies, and there are medications that you should not be on while pregnant for sure. But even I myself have a seizure disorder. And so I'm on lamotrigine, which you probably know is also for mood disorders. So I have a lot of clients who are on that for mood disorders, but thankfully, so when I got pregnant, I was worried I'd have to go off of that. But it's very safe for being pregnant.
Okay.
And so some of the medications that are less safe, like it's still better to maybe go on something else than to totally go off it. If someone has severe anxiety to where, it really impacts functioning, like to experience that while you're pregnant is not going to be healthy.
Yeah, I
for
wouldn't think so.
Or even, if I had another thought in my head, or, severe depression, like pregnancy is not fun. Well, okay, some people find it fun. I didn't find it fun. So to complicate it with a mood disorder or something like that,
Yeah.
when it could stay treated by medication, I just
Mhm.
think, it's a shame that there's some misconceptions out there. So I wouldn't be able to recite to you. I have a chart that tells me which ones, not that I prescribe, but I like to just have that with me when I
Yeah,
see
definitely.
that question those things.
Right.
So that was possibly the most valuable thing. Just because I just thought totally the opposite beforehand.
Yeah.
And it wasn't really based on anything. It was just an assumption that I had.
Right.
So that was really valuable. And then also there was, so much language about if the mental health piece with like choosing to nurse or not nurse.
Mm.
And I mean, my own experience, nursing was never easy. I only with only one of the kids did I do it a full year. And that was because we were shut up in the house anyways for COVID.
Fair enough.
So I just, it was helpful to learn ways to talk to women about like, it's okay if you can't nurse, and here's why. Like if it, going through just examples of if it's going to make you, if it's going to exacerbate like an existing mental disorder, or if it's just going to make the newborn and babyhood period really unenjoyable for you, excuse me, then it's not worth it. Like just get formula. I mean, I know formula is expensive. That's one reason, people try to nurse in the first place, but
Of course.
if you can make it work, and then formula is okay. And it's also okay to nurse. Like there's nothing wrong with that. So, so that was probably, those two things were just really helpful. I think possibly the most applicable, aside from just different techniques, like actual practical therapeutic techniques to use. And so from there, so I did that training, and I've just continued to ask at a healing place primarily for clients in that demographic, which they're great about giving me. And I'll see other clients too. But I have, like, this year and this last year, I've had probably, I meant to count beforehand, but I think 5 or 6 clients that have had babies, all just within the last year. So it's just been fun. And so that took me up to this past year. And then, as you know, I pursued EMDR training, eye movement desensitization and reprocessing. So I did the basic training for that. And my influence was my sister-in-law had done it. And one of the co-owners at a healing place is really, like, she's really championing it, and is very skilled. So she's my consultant now, or supervisor, essentially. That is the same thing. So I pursued that. I did that basic training last year in June and August. And so now I'm combining that. Like, I just signed up for a training. I don't think I have the name in front of me, but it's through Touchstone Institute. And it's called like perinatal deep dive, and it's EMDR with a focus on the perinatal postpartum population.
Wow.
That's so cool.
That is so cool.
It combines the two things.
That's awesome.
So I'm really excited about that. There's other ones through Touchstone. Like there's one I want to take called Empty Cradle, Broken Heart, because I have clients who have had stillbirth or miscarriage or.
Sure.
I'm so sorry.
No, you're fine.
So that's kind of brings me to now. So I love clients right now in that demographic, and especially when they're open to EMDR, it's just really fun.
Do you find that with EMDR that it's super effective with certain aspects that your clients are coming to you with? Or do you find that because I guess I always think of EMDR, and this may be my own kind of bias, but I think of it with pretty like highly traumatic things. Not that I guess that's not fair to say that, because a
Oh, I know
stillborn
what you
or
mean, right? Like big T
yeah.
trauma.
Yeah, thank you. Thank you.
Yeah.
So I mean, how do you see that sort of coming about in therapy?
Yeah. So it was developed, I mean, when it was first developed in the 80s, Dr. Francine Shapiro was the one that kind of like figured it out and developed
Yeah.
through an experience of her own. And her first studies were on war veterans,
Mhm.
and I think possibly people with eating disorders, but don't quote me on that one.
It sounds right.
Yeah.
It sounds
But for
right.
sure vets. And so, I mean, that's big T, that's extreme
Oh, yeah.
trauma, right?
Yeah. Mhm.
And so originally it was used a ton with them as it continued to develop and was shown to be effective and evidence-based. But since then, it's just like blossomed into, you can use it with anything. Like
Yeah.
I have clients that just want to start by just targeting anxiety, and we narrow that down. There's techniques to narrow that down and get to different specific experiences. And sometimes those are really traumatic experiences.
Sure.
But even like, so myself, I just saw my consultant, and she needs clients to reach the status that she needs to reach for consulting. And so she saw me yesterday and did what's called constricted processing, which is not like full EMDR. It's
Mhm.
you don't really like light up the whole memory network. So we're leaving soon for vacation, and we're flying. And I used to love flying, loved it, but I have not loved it since I've had kids, and we've never flown with the kids. I went to England a couple years ago and was terrified that the plane was going to crash and my kids would grow up motherless and all these things, right?
Yeah.
And so I have been panicking, well, or at least really high anxiety, thinking about like getting on this. And there's been plenty of plane crashes in the news.
There has been lately.
Well,
Yeah.
so I've been, just really anxious about putting my family on a plane. And so I was talking to her about that, and she's like, well, like, do you want to do some constricted processing just to desensitize the symptoms? I mean, because when I would think about it, my heart would start racing. And
Oh, yeah.
yeah, so we did that yesterday, and it was just incredible to me.
Mhm.
So in EMDR, there's this, well, it's not just EMDR. I mean, I think you can use it in anything, but the subjective units of distress. So it's a scale of 0 to 10, where
Yeah.
10 is highest distress and 0 is no distress. And so with constricted processing, you rate where you are at the beginning, and then you do some really fast of the bilateral stimulation, and the practitioner checks in every time after that like set of bilateral stimulation.
Yeah.
And it was, whereas in full EMDR you would allow like associated memories, or like you would notice what's coming up for you. It could be image, sensation, thought, color, shape, a feeling, a memory. It could be anything. So you notice
Yeah.
those things. But with constricted processing, you don't do that. You just keep checking. You do some bilateral stimulation, then you check where you are in the SUD scale. And that's just so that we're not accessing like, maybe everything that's connected to the anxiety for me. Because I know there are things that connected. One of the things I experienced in high school was my dad dying, and the plane didn't crash, but he was on a plane when he died. And so I know that's there, but we didn't go all the way back to that because we just
Sure.
didn't have time. And she's not my therapist, right? This was educational.
Right.
And so anyways, she did constricted processing just to desensitize the panic and the tightness in my chest and the lump in my throat and my fears. And so something she said was, at the beginning, what image represents the worst part of this issue? And for me, this has never happened, but it was the image I'm imagining was sitting on the plane and the oxygen mask coming down and like asking myself, or like realizing I can't protect my children, right? Like you don't, if a plane is going down, it's going down.
Yeah.
And so it's this horrible, horrible image. And so we start with that, and then she does the BLS. And then so after every time she'd ask me where I'm at on that scale, and it just so quickly went down. And I mean, to me, it feels like magic, but
right.
it's not. It's our body just wanting to heal itself, and wanting to heal psychological wounds. And so by the end of, I think it took maybe 30 minutes from start to finish, and not everyone will move that fast, but like someone who maybe had someone actually die in a plane crash, like that, it probably wouldn't move that fast, right?
Yeah.
But for me, we're desensitizing fears of something that hasn't happened, hopefully won't happen. And so it just moved really fast. And I was down to a 0 by the end. And I moved from, what's really cool is I moved from like, that's not the image I have now of us traveling. By the end, I was focused on like smiling with my kids as they're really excited to get on the plane and experience this new thing. Right? Like that was not even on my mind before. I was just afraid of flying with them.
Wow.
So that's just an example of,
no, that's a great example.
Using it with like a big trauma, right?
Yeah. No, I
so
could
even with the demographic I see, if someone, I don't know, if it's just like, I can't handle my kids' tantrums or something like that, right? It's not necessarily like a huge trauma, but we can desensitize what's going on for you there and see what else, is there something in your history that's lighting that up for you?
Wow.
Yeah, so it's been cool.
So
I'm excited to just keep going. I'm fresh in it, right? It was just last year I did the training, so but I'm pretty excited about it.
Wow, that's awesome. Okay, cool.
So nice to hear different things that
I know. Yeah.
Cassandra and I have no idea about, right? Hearing your firsthand experience, that's really neat. And I think we need more people who are, practiced in this area. And, you benefit from it. I imagine others would benefit from it as well.
Yeah, it's been really neat. Sorry, go ahead.
No, I was just going to say that the one thing that kind of stood out to me was how it sounds like, especially when you're starting off with clients who are coming to you for miscarriages or things like that, like or even just like infertility issues, you're dispelling a lot of myths, which makes me think of like when I'm doing sex therapy with a client, we're dispelling a whole bunch of myths, right? Just a lot of stuff. And so, or even just, I'm sure, Tori, you see this.
Oh yeah, with couples, absolutely.
There's, and I know, Kelly, are you level 3 Gottman, right? Or level?
No, I just did level 1. Yeah. Oh, okay. But I don't see couples anymore.
Fair enough. That's okay.
Which I think, Tori, you see couples, that's incredible. Like I have so much admiration for you.
Well, and likewise for what you do.
Yeah. Seriously though. But yeah, just like like you had said at the beginning, right? There's this sort of overlap across.
Yeah. I mean, with the myths thing, like infertility, it's dispelling so much of the, people get comments of like, well, stop trying, just relax, like it'll happen, or take this like homeopathic remedy. And I'm fine with homeopathic stuff, but that's not necessarily the answer to infertility when someone's in the thick of it, right? Like, or telling them to relax, things like that, like, or even comments, even for there's secondary infertility too. So someone has a baby and then they want more, but they're not getting pregnant, right? And someone says to them, well, be grateful for the child you have, and then makes them feel like they're a horrible parent because, oh yeah, am I not grateful for my kid? Of course they're grateful for their kid, but they want more. And that's really hard that they can't have more.
Yeah.
And so you're right. The dispelling the myths is a big part of it. And that helps, I think, in the building rapport period as well,
Mhm.
just to, let clients see that like you're not coming at them judgmentally. It's okay that they
Yeah,
want another kid even though they already have one. Yeah, so
sure. Okay. Tori, do you have any questions over there?
No, I'm just kind of taking it all in.
I
Like I was
know.
saying to Cassandra before we started the call today, just like I love hearing different ways of practicing and other
Yeah.
people practicing. I think sometimes we get into our own heads or our own niches, right?
mhm,
Cassandra and I both working virtually.
mhm.
It can be, I don't want to say isolating, but like, working alone,
That's
like you get
fair.
kind of entrenched in what you do. And
Hmm.
like while I see all different sorts of couples, like, it's a lot of the same kind of issues and stuff. And so I find it so intriguing to listen to a different expert and different modalities. And it's just eye-opening. It's really cool just to listen. So I'm really
Yeah.
appreciative of you sharing and like your personal aspects of this as well. Like you are quite candid today.
Mhm.
So I think a lot of people can resonate with that
Mhm.
too.
Yeah, definitely.
Yeah, I just feel like those experiences really tie into why I am where I am. So, which
Definitely.
I'm sure is, you guys
We
could
all have our
probably say the
journeys,
same.
Oh
right?
yeah.
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 Yeah. I think that's why I love asking about it. Like, how did you start off? Because everyone's story
Mhm.
is a little bit different. I mean, you and I, Kelly, like we met when we were just sort
Yeah.
of starting out as
Young.
therapists. Yeah, like baby therapists.
Yeah. Yeah. Yeah.
But just to have kind of similar experiences as in like our degrees, but then just verging so differently in certain areas that we kind of became very expert in. So
Yeah.
interesting.
Yeah. Hmm.
Okay. Well, thank you so much for being on our show.
Yeah,
Thank you so much for
wonderful.
having me.
Yeah. Okay. And I believe next time we are doing a book club
Oh, yes.
episode. So
Hmm.
Stay
stay tuned for
tuned.
that. Okay.